Who joined us by phone? Is that you? Okay, awesome.
You want to know too much information?
Sure, why not?
I wear hearing aids, and this is the only way I can get the audio, so it's not like on speakerphone. It's a Bluetooth through these.
Awesome.
Technology, people. It's great.
Hi, Danielle. Hi, Lisa. Hi, Charles. Hi, Liz. Charles, you're outside. That looks cold.
Yes, this is what you don't get to see the lake, but you don't get to see the lake.
That's beautiful. Nice.
For just a couple more folks who were expecting most of you all, and we only have 6. So we'll wait just a couple more minutes. Hi, Chris. Hi, Eric. We're waiting just a few more minutes for additional folks to join us.
Great. Good morning or good afternoon. Yes. Hello, everybody.
Good afternoon.
Who is joining us by phone? Your phone ends in 169.
I know Jacqueline. This is Jacqueline with US Vets is joining via telephone.
Thanks, Jacqueline.
You're welcome. Hello.
All right, we're waiting just another minute or two for folks to join us.
Okay, thank you.
Hi, Jackie.
Hi, Katie. How are ya?
Good, how are you?
Good, thank you.
All right, we'll go ahead and get started. So the majority of today, we are going to be back in Mural doing some exercises around your y'all's charter and also around your kind of strategic action plan and what you all want to see as part of your strategic plan, and then how you all want to be involved in the regional action plan. But before we do that, just want to do a quick round of who all is here. So if you could just say name and organization, because we're still all getting to know each other. And I will call on you so that we don't have just people talking over each other, and then you all can call on the next person in. So Tish, since you joined us first, you get to be first.
Bishop Brown Gambino, UMOM New Day Centers, and Charles.
Charles Sullivan, ABC Housing. Eric.
Thanks, Charles. Hi, Eric Cole from the Watts College of Community Solutions at Arizona State University. Jackie, you're the first person I see.
Good to see you all today. Liz.
Hello, Liz DaCosta, Senior Director with Community Bridges, and I picked Danielle Wright.
Danielle, you're on mute, so we can't hear you.
Sorry, Danielle Wright, Victim Services Manager at the Arizona Coalition to End Sexual and Domestic Violence. I'll choose Lisa.
Good afternoon, Lisa Glow with Central Arizona Shelter Services. Ryan Balch.
Hi, everyone. Good afternoon. Ryan Balch with City of Chandler.
Ryan, I'll hand it over to Rob. You're supposed to pick some.
Good afternoon, everybody. Rob Hodlager, Valley of the Sun United Way. Chris?
Hello, Chris Hallett, City of Peoria Neighborhood and Human Services. And I'm sorry, I don't know who hasn't gone yet. I stepped away.
No worries. Jacqueline Campbell, over to you.
Hi, my name's Jacqueline Campbell. I am with US Vets. And unfortunately, I am not able to see who's all on the call due to calling in from my phone.
No worries. Joan, I believe you are up.
Am I unmuted now?
Yes, you are.
Sorry, am I? Okay, fantastic. I'm like, why is it telling me to push these things? Okay. Joan Service, Arizona Housing Coalition. I am also on my phone, but I'll be back in front of the computer in about 10 or so minutes. And can you call on somebody else for me, Katie?
Actually, I think that is it, unless I missed anybody. Let's see, no one screaming, shouting that we missed. Staff who are on, can you please just do a quick intro? Katie Gentry, I'm a Human Services Planner here at MAG.
Hello, Amy St. Peter, the Deputy Executive Director with MAG. Happy to help out and listen. Thank you.
Hi, I'm Nikki Stevens, the Regional Homelessness Program Manager with MAG. Nice to have you all.
Awesome, thanks, staff. So as I mentioned, we are going to spend the majority of today talking about where do you all want to go as a board. And so first thing before we jump into that, I want to spend a little bit of time just reviewing the roles and responsibilities that you all approved as your new charter. The first part of today, I would say about the first third of our meeting, we're really going to talk about what do these steps look like in action. So you all passed kind of some really big lofty goals of you want to make big strategic plans and really be more policy driven. And so we're going to spend quite a bit of time today talking about what does that mean and what does that look like to you all and how do you see that heading into action. So I'm going to share my screen. This is the charter that you all passed. I'm hoping you all can see this. This is the roles and responsibilities that you all felt were kind of very needed in order for you to make steps forward in the next year or so. And so really just wanted to, I will read through these for folks who are on the phone. Number one, make strategic planning and policy decisions for COC funded providers and agencies. Number two, set strategic priorities for the region and make regional policy recommendations to local leaders, regional council, state leaders, and additional partners. Number three, promote understanding in the community and educate elected officials, agency heads, and community leaders regarding policies and actions to prevent and end homelessness. Number four, convene diverse stakeholders that address and are impacted by homelessness. Number five, develop an annual strategic plan. Number 6 through 11 were things that you already had in your charter before and are required by HUD as being a COC. So you have to hold meetings, you have to have new members, you have to establish committees and work groups to accomplish your work, designate an HMIS, assist in developing a governance charter each and every year, and then responding to the NOFO. We have pretty clear direction as to what that means from you all. And so don't want to spend a ton of time on those, but then jumping back into number 12, recognizing accomplishments, provide support to and take appropriate action on the performance of agencies and organizations in the COC. So really we're going to spend the bulk of today talking about kind of those 2, 3, 4, and then number 12. And then the entirety of number 5 is really what we are hoping to have today in our session on the 25th to say, these are the things that we want to take away and be part of our annual plan that we want to accomplish before 2022 is up. I see a lot of heads nodding. Awesome. We're in agreement of what that means. The other thing that we are hoping to accomplish today is to really talk about how you all want to be involved in the regional action plan, and are there steps or things that are not, we haven't designated as to the COC that you all want to be involved in. The secondary piece of that is there are a lot of actions that you all are involved in as far as the COC, and is that really better fit at the committee or one of our subcommittees like the data subcommittee or the coordinated entry subcommittee. So that is kind of the layout of where we are going. Do you all have any questions about this charter before we jump into that? I'm hearing none, so I was clear as day, which is awesome. So really, we're going to spend the majority of the time jumping into this mural board. I just sent the link in the chat for you all to have access. I'm hoping you all have visitor access and don't need to log in like last week. And I'm also going to share my screen so that you all can see what we are going to do. I see a bunch of people joining, which is so exciting. We're going to spend the first part really talking about these purple boxes. So these are the 5 different groupings that we just talked about as to how you want to implement the charter. And the question really that we are hoping to answer is what does implementation of this look like to you? So really throw ideas into there about this is what it means to me. This is how we want to have it done. This is what we're hoping to see come out of it. And really kind of feel free to click on any of these purple boxes, type in here to answer any questions as you kind of get started.
Can you make it a little bigger? There.
Lisa, you should be able to click on the link and actually join it on your own, and then you can zoom in and out on
thank you.
Your computer as necessary as well.
Thank you.
My internet connection here won't handle that site.
Charles, if you have any like thoughts or things, you can put them in the chat and I can add them as you are thinking them as well. You can either private message me or group message the entire group.
Will do, thank you.
Katie, it seems that the chat is disabled, so just unless it's just on my end.
Katie, I'm a tiny bit confused. So what is it exactly you're looking for on our stickies?
I was muted and trying to talk to you. So really in each of these stickies, you're going to click on each one of them, and in each of these sections, so under make strategic planning and policy decisions for COC funded providers and agencies, what does that mean to you? How do you want that implemented? Is that something that the board is responsible for? What does that look like? Does that help guide direction?
Yes. So you just put your thoughts on that sticky.
Yes.
And then do you drag the sticky somewhere?
Nope, you can just leave it there. You're going to just
leave it.
if you double click, you should be able to start typing, and then you shouldn't have to move stickies at all.
Got it. Thank you.
Yep.
Lisa, are you still needing some assistance?
I just figured it out. Thank you.
Okay, great. Very good.
Thanks.
Danielle, are you having issues accessing Mural?
Yes.
Okay. Let's see what else I can do. Hold on.
I thought I was the visiting rabbit, but I can't seem to do anything with that.
If you double click on any purple sticky note, will it let you do that?
No, it just changes the size of the screen. I'm either exiting full screen or going back in.
I'm visiting Rabbit, so
Oh, okay.
I don't know who you are.
Danielle, if you're on the bottom right corner, if you're looking at my screen, there's this like move mode. If you click on that button, it should allow you to then double click on things. Does that allow you to do that?
Say that again. In the right corner, I see that.
If you click on that button, and now do you have a hand or a cursor?
I still have a cursor.
Okay, then can you double click on any of the purple sticky notes now?
No, it's doing the same thing.
Okay, if you want to just send any thoughts or ideas into chat in Zoom, I can add them for you.
Okay, thank you.
Yep. Ryan, your question about looking at action plan now. No, we're going to wait, just focus on these ones for now, and then we'll move down to action plan in about 15 minutes. All right, we are going to go ahead and start working through some of these that are up here. So we'll start with this first section, strategic planning and policy decisions for COC funded agencies. Feel free to jump in if you were the ones that wrote this or have additional thoughts to add as we kind of walk through each of these. So define what kind of policy, you all can still see my screen, I hope. Yes, okay, awesome. Set general and sometimes specific direction to the region related to systems level policy and goals. Define what kind of policy decisions we will focus on, and more importantly, what mechanisms for taking action are in place. Provide an inclusive feedback loop to and from COC funded providers, RE policy decisions, and SP, I'm thinking that system performance. Is the previous plan reviewed and are the goals met highlighted? The charter calls for an annual strategic plan, which in my humble opinion should be where we hold and accomplish these 4 buckets. The NOFO annual requirements to have updated systems performance measure are all inputs for this. Query if these are made as decisions for the providers and agencies, or is there an iterative process? I don't understand this. So I heard a lot of, we are making decisions. However, how are we making those decisions? And then how are we getting that back to providers, and how are they influencing these decisions?
I was the one who wrote that about the iterative process because I didn't understand. We make decisions for them. Do we make them after they've had input? That was all.
Okay. Any other thoughts that we're missing in this? Here, crickets and see no faces.
Can you give me an example? Like what would be a policy decision we would make for the providers?
So something that would fall into this, and anybody else feel free to jump in as well. This would be anything around like HMIS changes, coordinated entry changes. What are the priorities of the board? So are you preferencing length of time homeless as a greater priority than a certain subpopulation, for example?
Okay.
This is like something that you all have been doing for a while, and this was in your last charter, but this is something that we brought stronger language into it when the charter was rewritten.
Thank you.
Any other thoughts or comments on that before we move on to the next one? Is this something that you all feel like you are doing well at this time?
So can you hear me? It's Eric.
Yep. Hi, Eric.
Sorry. So, I mean, this is kind of a dumb question, but I'll just ask it. And it might be, I know what, I'm asking it for the newer members of the committee. do we have, I mean, I know we have annual, accountability reports, et cetera, that we have to provide to various agencies, but do we have an annual strategic plan? I guess as is talked about here as a board. And if that's a dumb question, I'm sorry, but I'm just asking it.
Other board members feel free to jump in. My understanding is you all have not had an annual strategic plan up to this point.
Okay, that's what I thought, and I'm not, there's no judgment or anything. It's just that helps, because that was my orange comment, just saying, I think working through that actual framework is our opportunity, right? So, thanks.
That clarification helps a whole lot.
Okay.
Thank you.
Thank you.
I think this is the previous plan reviewed and are the goals met highlighted. There wasn't a previous plan, to my knowledge, specifically for the board. It has been
right.
Mostly how are we responding to the NOFO? What are we doing in response to the NOFO? NOFO is Notice of Funding Opportunity. That's our annual application to HUD. Please stop me at any time if I'm just using an acronym that is not familiar.
No, that's to me, Katie, that all is really helpful, because I know, it's not that we have done some, I think, very good work on strategic planning. But yeah, I did not think it resulted in an actual plan document. So this is good. And I think this is what we envisioned when we did the charter revision. So cool.
And that is something that ideally we are going to spend the last third of today and all of our next session really kind of hammering out, is step 1, step 2, all the way to step however many you all want, as to what you hope to accomplish by the end of the year. So let's move on to this next one, setting strategic priorities for the region and making regional policy recommendations to local leaders, regional council, state leaders, and additional partners. Seems the MAG strategic planning, which I'm assuming is the regional action plan for local and tribal governments to address homelessness. And we should also align, and I think we need to compile information about what is happening regionally as it happens. Example given, the hotels to housing, the scaled up housing and diversion funding, etc., and measure it to various regions. Some sort of monthly dashboard is needed. Challenging to identify the how, but I do see this as the board's role. This may happen through action plans, written policies, goals and objectives identified in the strategic plan and elsewhere as the need arises. I believe we need to advocate at the state level to get a state plan that is informed by the regional plans and the continuums of care with membership on the state plan committee. Identify the best inputs for annual needs and gaps. Then these drive priorities for the region. Perhaps staff take needs/gaps and match them to existing programs and present to board annual priorities. I see heads and nods. Yes. Do we have additional things to add to this? Do we have more input? Can you all see this and are able to kind of follow along as I'm reading this? Awesome.
The idea of measuring for me is, it seems like strategic priorities have been set for the region in a sense with the MAG plan. And what I'm saying is, Katie, on our training, you said there were 3 priority areas: regionalization, something with services. I forget the 3, but under those 3 buckets, it seems to me it'd be manageable to across the region what's happening. And maybe this is already being compiled, but people will ask me what's going on. I'm like, well, I know Mesa's working on buying a hotel, Tempe has, Cass has done this, CBI is looking at doing that, St. Vincent de Paul is going to have 100 units at Watkins. And I gather it from talking to people, maybe there is one place to go for that. Then what's going on with prevention dollars? What's going on with rapid rehousing dollars? Is that our role? Or is that a MAG role? I just think it would help guide our direction with funding if we knew what's so in the region. So maybe that is already done though.
Other board members, do you all feel like that is your role? Do you have thoughts on that? Eric, you took yourself off mute. Did you have something else to
Sorry,
share
yeah.
that wasn't my question?
No, I do have a thought, and it kind of relates to a later question where we talked about convening, and somebody I loved where somebody said, look, we, MAG / the COC board don't have to convene everything. Others are convening things like, can we help, pull it together and align it? And that's where I think, to answer that question, Katie, it's like, we may not be the ones that do, the work, but it strikes me that there's not enough. I mean, it strikes me we're the body, I guess. And maybe it's like it is in recommendations to the regional council. But it strikes me that yes, I mean, that is the role, exactly what was just what we've described, both like clearinghouse, but also, gaps, needs assessment, and then, prioritizing going forward. I believe those are pretty much our key roles. And it may be, again, with each of those, it might be some other entity that is enacting, doing the work, et cetera, but that we're the ones that, can shape that and, I guess, ratify it, I suppose.
And maybe it's data that's already coming from MAG. So I could see like a Excel spreadsheet or something, beds coming on in what kind of beds. I mean, I know this is already gathered, the number of emergency, the number of transitional, permanent supported. Sorry, someone was talking. And then housing, like and then the convenings, as Eric was talking about, and this was in a prior meeting, who's convening and doing what, because there's a lot of activity. So to have it in a, we know what's going on in the region, seems to me we need that foundational before we can identify gaps, if this is happening, and where is shelter still needed, and what do we know is being worked on in the community that's going to possibly fill that. Seems like that would inform funding decisions too.
Yeah, I agree.
Yeah, Lisa, I would agree with what you're saying. Sorry to cut in, but I do think having a centralized place for that would be great. I know with technology, it's probably something that would be able to be displayed and searched and all of that good stuff. But I do think that would be something we would want to be able to support, to be able to help communicate externally.
And I think we mentioned that before, wanting to know what other subcommittees are working on, if they're working on resource mapping, or they're working on what other providers are doing, the most recent funded activities, how many units are coming online, where they're coming online. And I know that some of the work groups are doing this same type of strategic planning around, putting together these charts and resource libraries, so we know what's going on in our service community. So I think that's an excellent point. If we could have some type of centralized, I don't know, clearinghouse for all this information, that would be very helpful.
Ryan, I think you are up next.
Yeah, I would just add that, so all of these things that we're talking about exist in different reports. A lot of it's on our Continuum of Care webpage, in the materials section. So there's a lot of this stuff that exists, and I think it's maybe about organizing it in a way that is easily accessible and people would have awareness of how to access these things. Because we have just, it's interesting to be strategic planning right now, because we have just as a region gone through we've approved a plan. So a lot of our, I feel like as a board, a lot of our goals and objectives are sitting in front of us, and we need to determine how, as a board, do we fit into the plan that's been developed by the region, and how do we create policies and be able to, you know, be a lead for some of that work and make sure that that action plan is implemented. We're certainly not, it's going to take everyone in the community to do all that. But how do we serve as the, you know, a centralized hub that is leading the charge, ensuring all of the progress is communicated, ensuring that when new things come along or new initiatives are being discussed, we can be a place where people can find out about that and be connected to it. So that would just be my comment.
I echo that. And then what we decide we really want to be counting, I think it's important to have centralized and then further drill it down to what are the things within those 3 buckets that we want to be, you know, what you count counts. What is it I just think it will help with some of these other goals when we talk about talking to the community and where we need their leadership. So I think it'll get more refined as we see that all together.
I just have a quick question, Katie. When was the last gaps analysis completed or needs assessment?
You're scratching my memory right now, but I believe we hired a consultant in 2018 to do a complete SWOT analysis, looking at our strengths, weaknesses, opportunities, and threats, and that included a gaps analysis. And then as part of the regional action plan, there was a regional strategies portfolio developed in 2021 that was passed in May of 2021 that did like another complete look at all the different strategies that could be involved. And that's what led to the regional action plan being developed. So specifically on the COC system itself, 2018, but as like our whole regional system, 2021.
Okay, thank you.
Eric's shaking his head yes, so I feel at least semi-confident in that response.
Yeah, I think that sounds about right to me. Can I speak, or was somebody ahead of me? Okay. You know, I think about 2018, and my God, it was a lifetime ago. Pre-COVID, Amy said correct. Pre-COVID, right? Lots the regional work together, and I sort of agree. I very much agree with Ryan that I think we have a lot of these inputs. We just have to organize them, sort them, and then, you know, part of our responsibility is do the goal setting and the stretch goal setting, right? Because we want to move the status quo. I have another request. It kind of is along those lines, and I just am going to ask it, and it doesn't have to be now. And it's not like a gotcha kind of a question. But the other piece of this is like when you're doing this kind of work, you know, it's important, I think, for us to have a sense of what our staff is doing, and y'all are phenomenal. Our MAG staff are phenomenal, but we have had a lot of change. I think at some point it would be nice, and maybe others know this, so maybe it's just a conversation I have with the right folks. But I think it also would be good to know what the work plan is for the MAG staff, because, you know, you're subject matter experts in this. You're doing day-to-day great work. So I think the other part of it, I know for me, and I think for a lot of us, it's hard to separate the strategy from the doing. So I think that would be a nice input also to kind of know, oh, this person's covering this piece or this piece. That might, you know, help us as an additional input down the road.
I see heads nodding, so I think that is probably Eric, you are not the only one who doesn't know that. So we can work on that and get that either presented during the next board strategic planning or at a future board meeting.
And you know, please hear me that it's not you know, again, not wanting to create extra work or go and, you know, give us a report, totally cool just to talk it through, I think. But but I do think it would be really helpful discussion for us.
Awesome. Any other thoughts on that section before we move on to understanding? Okay. So promoting understanding, agree, policies and actions are best to prevent homelessness. We need to tie them to the regional plan and create a 2 to 3 page white paper that can be handed out. We need to convene community champion groups with business, media, electeds, and others to have a feedback loop on this. We need to include a group who will do this and tie it to the outcomes and goals in the regional plan. We need to include grassroots organizations, informing them as they sometimes work in silos, and when they have used all of their tools, they don't know where to go next. That was a weird pause, sorry. Have this work group meet with local govs and provide toolkit and presentations. One tactic may be intergovernment councils. All this material exists, but it is more about organization and making it easily and accessible and aware. Other thoughts on that? All right, convening diverse stakeholders. I believe we should have opportunities for all providers and those impacted to communicate directly to the MAG board. We need to create a community-friendly pathway. Thank you for our mural board last week. We will be working on that and have some ideas coming to you next session. I feel strongly we need both neighborhood and business leader stakeholders and should add neighborhood leaders to the COC too. I think there are many entities that can help convene, but it would be nice if the board could serve as a centralized hub for being aware of all of the activities and information to ensure coordination and avoid overlap or conflicting priorities. Agree with both of these points to the left. We/our staff don't have to control/convene all of these, but can we align them? Thinking about PCA, Phoenix Community Alliance, United Way, and affordable housing groups. The question of who is convening and doing what, and we need to understand what others are doing so that we can better support and share out of the work being done. Any additional thoughts, comments, points to add there?
I wrote in there about neighborhood individuals, leaders, and I should have spoken up at our last meeting where you asked who else should we put on the COC board, and I know we have community seats, and I think we need to put more emphasis on getting neighborhood leaders because I don't know that we have them on right now, or if that's been a priority in the past. And I think if we're going to be able to do some of the work in the regional plan to get into communities, having those neighbor leaders, the City of Phoenix Homeless Task Force has a number of neighborhood leaders involved.
Other additions, thoughts? Thanks, Lisa. All right. So the last one, recognizing accomplishments. So COC spotlights, quick and easy recognitions for outreach workers, housing navigator, volunteers of the month in the system. Longer term, officially engage a program evaluation partner unless we already have one on contract. What is currently done in this domain? I am too new to know, and how would we take action on performance? Can we instead have a dashboard of measurements monthly we want and then share those publicly so that there is transparency? I'm thinking of the COC as the go-to place for information on what is being accomplished for the community tied to bigger picture goals. Yes, ongoing evaluation and feedback with COC funded providers is essential, and from my perspective has been lacking. We should be commending and replicating excellent outcomes and providing TA where their outcomes can be improved. My preference is that this is performed by MAG staff.
How does performance get evaluated of COC providers?
Great question, Lisa. There is one of the things that was redone in this charter, or I guess was already in the charter, but emphasized more, is that MAG staff is responsible. HUD is ultimately responsible for the monitoring and the monitoring of HUD funded contracts, however, or of COC funded contracts. But it is our job as MAG staff, because we are the collaborative applicant, to do monitoring and evaluation of those agencies. And then on top of that, I will say that that does come up in the scoring when agencies compete for the NOFO. That scorecard of the NOFO, it is reflected if you have organizations doing really well versus organizations doing not so well, is reflected in their scores on a yearly basis. One other thing that you all have tasked the committee with in the charter is having the system performance measures reviewed and evaluated on a quarterly basis, and also made the committee responsible for best practices. So not only will they be reviewing system performance measures, but also saying how can we better improve the system performance measures that we are lacking on. Additional questions, thoughts on these? Is there anything that you all feel are missing from this first section, need to spend more time talking about, should be acted upon and included in your strategic plan?
I guess I would just ask, following up on that last comment, Katie, which was mine, is there a plan for that? I'm feeling like since it's in our charter now, there would be a plan for that.
Nikki, are you there and can you speak to this?
I'm sorry, can you repeat the question?
Yeah, what is our monitoring and evaluation planning from a MAG staff perspective? And can you just kind of talk about our plan of action with that?
So we are looking to provide some monitoring and feedback to organizations that did not score really well the last go around. And we also plan on doing some monitoring and evaluation of the coordinated entry system as well.
Okay, I guess I would just ask, so we have how many MAG COC funded agencies now? I mean, that's a rhetorical question, a lot. I mean, and how are we on an annual basis actually evaluating their performance? Are we doing on-site monitoring? Are we getting regular reporting? Because that information is really important in terms of who we put forward in the next year, not just self-report, but are we getting out there? Are we seeing what they're doing? Are we looking how they're weighing in for the system performance measures? Are we looking how they're impacting their particular population? Because system performance measures aren't everything. Are we seeing what their strengths and weaknesses are so we can put the very best projects forward every year? And I feel like we've been wanting to do that since the beginning of time. And I'm not sure we've actually accomplished an annual system for that. And from my perspective, that's what we were trying to accomplish in the charter, was to get this annual system in place. And not to be punitive, but that's not my philosophy on monitoring, but to actually see the work, understand the work, look at the outcomes, offer technical assistance when it's necessary. I mean, we're theoretically responsible for, it's not theoretic, we are putting forward the recommendations each year for which agencies should receive $33 million of continuum of care funds. HUD is taking us at our word. I mean, they're monitoring periodically from a compliance perspective, a regulatory fund compliance perspective, but they're not looking at outcomes and how the service is impacting homelessness in our community. They're looking at compliance, which is a very different thing. So when and how are we going to get that system up and running in our community? Like, it's an essential piece that I haven't seen yet, that I'd really like to see.
I 100% agree with you, Ryan, and we've internally had those discussions around that, and it's something that's important to us. We are going to start desk monitoring, obviously, because of COVID, that kind of put a kibosh on us being able to go out and actually look at programs and how they're functioning. I know that, when Kanari was here, we looked at some of the reporting that she had done, but that is a priority for us as an organization and for obviously for the people we serve, that's number one. So that is something we're looking at. We have stuff on scheduled to do some desk monitoring, some self-assessment, and then we're going to do a deeper dive, but I don't have a timeline for you right away. But we do have the coordinated entry evaluation coming up, but also we're going to be looking more closely that the Julie Montoya on our staff is working to get that scheduled.
Okay. And again, I don't mean this to be punitive. That's not my monitoring philosophy. I mean it to be supportive. I would very much be in favor of the providers helping us to design whatever the monitoring looks like so that they feel it's reflective of, you know, the asset they are to the community. But I do think it's important that the board actually and that everybody have access to understanding what are our dollars accomplishing, and are these the right set puzzle pieces we're putting together to accomplish the goals that we've set out for our community.
Yes, and even during our coordinated entry subcommittee, we're talking with HMIS and looking at some of the questions that may be helpful in us determining how successful organizations are in ending their homelessness and looking at, you know, returns to homelessness, looking at racial equity. So those are things that we are working on and looking at.
Okay, appreciate that. Thank you.
And being new, that was a helpful conversation for me to hear. And you know, what more do we want to know? I'm not sure, because I haven't been in the review process on the awards and as involved, but are technology solutions needed in this domain? That may not be the issue at all, but whenever I hear about systems and data and outcomes, I think, is there a technology solution that you all have been looking for, that funding is needed for, that would help with that?
And some of this information does come to us. I don't want to give anyone who is new the wrong impression. Some of this information does come through us through the annual scorecard, which is how organizations are evaluated for inclusion in the next year's grant. But it's not necessarily a deep dive, and there's no follow-up. If we do see areas for improvement just based on this scorecard, there's no follow-up with that organization to say, okay, we saw this, let's figure out what the solution needs to be. So you might just see that again next year. Hopefully the organization looks at the scorecard and takes that into account, but maybe they don't know what the concern is, or, you know, whatever. So I just think the board that's like a very base level function that the board should be aware of and somehow accounting for.
Ryan, this is Jackie. I agree with that. I think
Jackie can barely hear you.
I'm having sound problems, so let me chat.
Okay.
Kind of, as Jackie is typing that, don't let me be a distraction. But the next kind of, unless we have more to chat on this kind of subject or are there any other things that we are missing from this top section that you all feel like we should comment on, say more about, talk about? Did we do a good job capturing kind of what your initial feedback was going into this?
I guess I would also just say I don't want to discount the other ideas that are in there too. Like I saw one that was like highlighting, you know, good things that funded agencies are doing. And we used to do that, COC spotlights, that's what it was. We used to do that, I think at the committee level. So there might be some ways to, I mean, yes, we should be celebrating our successes throughout the year, not just in relationship to, you know, the no fo we're putting forward each year. I mean, I like these other ideas as well.
Jackie, the follow-up to the monitoring is critical. I think monitoring also provides the board the opportunity to get in touch with some of the barriers providers are facing in terms of service delivery.
One idea I'm just going to throw out there, and this is really kind of dependent on what level of engagement the board wants to have. but even in these times, it's a little bit more difficult, but board members we could do site visits, and they might not even be necessarily combined with the evaluation piece, because that's a little bit more technical. And I would hope that MAG staff would get involved with that piece and deliver information back. But site visits, if you could do a number a year, with board members actually going to see what the agencies we're funding are doing. And they could be virtual for now, where you give that not during the evaluation process, because that's, that's just another burden for the providers, but just during the year, you just have an opportunity for COC funded organizations to get in front of you and say hello and tell you about their program, show you some success stories. So there's actually like a name and a face and to it. I would like to see some more engagement and involvement that kind of looks and feels like that, I guess.
I love everything you're saying, and it makes a lot of sense to me too. Cass is the lead provider on something called the Glendale Master Services Agreement. So we've implemented basically with subcontracted partners a system of monitoring, and we have it's smaller, much smaller than this, obviously. But we have a monthly meeting required with all the providers. We have other meetings required on street outreach, and it's led by some of the providers. We have other things like that were part of us writing this grant that we competed for in Glendale. But I think that would really elevate things to hear more from the providers and giving them a place to brag. And then tied to, I've been talking about dashboards with regional, but what about dashboards with the partners as well that would be shared with us? So it's that, like, what are those high level things that we need to be seeing that we know the needle is moving forward? I can't define that, but I like where you're going with this. And Eric wrote in the chat, they did that in his old COC in Nashville.
Yeah, the board volunteering thing, but we kind of had to.
I remember that at the committee level, we used to actually do a COC spotlight, and they would share with the rest of the committee. But just an idea is like, what if the committee put forward a COC spotlight? I hate to say every board meeting because maybe we wouldn't have time, but to just get us to see, a 5-minute, spotlight on whatever organization they were presenting that month. They could ask the organization to do it, or they could ask, I don't know. I don't want to get into the details, but something.
I like that idea. I mean, at our agency board, we do a mission moment at every board meeting, and it's an opportunity. That's something a lot of boards, I see Eric nodding his head. So it's an opportunity for our programs with vets or seniors or something like Glendale, and it brings the board up to speed in, I think it's great.
Yeah, I'm nodding. Our chair does it on the Maricopa County Workforce Development Board, and what they do it's like a success story, and it doesn't have, we don't have to get the client. I mean, that's cool too, right? If you have lived experience, but caseworker, outreach worker, somebody that's done training comes and just tells a story of a success story. And it personalizes things. And honestly, it's one of the parts of the meeting I look forward to every month. So.
I don't want to squander this conversation, but I also want to move on to a regional action plan and how you all want to be involved in that. So there's kind of 4 big places that we as staff recommend that the COC at least has a hand in. Obviously, you are not solely responsible, but you have a group of committees that can take on some responsibility, as well as MAG staff who are kind of leading this under the regional action plan. But wanted to just take about 15 minutes to talk through the regional action plan, how you all want to be involved, or if you want it to go down to the committee or subcommittee, what subcommittee, and then what does the frequency of updates look like coming back to you? Like, how involved do you want to be? So the 4 steps are really improving access to data on homelessness. So that is not only doing an evaluation of HMIS, which you all heard about in your November meeting or your January meeting. I think it was your January meeting. There's a plan to move an evaluation through that, and they gave a timeline. The next one would be the regional action plan, adding 770 units of temporary housing and 1,225 units of permanent housing. What does that look like? This is mostly going to be municipal driven, but are you informing where these are going or how these should be impacted? And these are units directly for homelessness, not just low income units or anything like that. The third one, assess and enhance the coordinated entry system. I think, as you all have heard, there is a coordinated entry evaluation currently on the street. The RFP is on the street, and that is due February 9th. And that will be kind of underway upcoming. And then the last one is increasing access to local services, such as medical, behavioral health, and substance use treatment programs. And that is also inclusion of getting connected to other programs. So how are we staying connected to other systems of care, whether that is behavioral health or hospitals or kind of all the other things that are not just like completely homelessness driven. Questions on any of those before I release you all into the wild of clicking on sticky notes? Awesome. Eric, you are on mute if you were talking to us. Okay, awesome. And again, if you can't click on these, feel free to send any thoughts in the chat and I will get those added to our mural board. We see folks slowing down. Are we feeling complete? Do we have more to add? All right, I'm hearing none, so I'm going to start reading these, and if you all have more to add, feel free to stop me at any time. Okay, improving access, elevating the outcomes and work of the LAPP and other data sharing projects. That is the data warehouse with access and the 3 COCs. I'm hoping the new dashboard will help with this. Incorporation of DV data into the homelessness data. I think data should be a regular agenda item on the COC meetings, and that we need to decide what areas of measurement are most important here, then talk strategy every meetings. Maybe there are 3 to 5 areas on every agenda as part of our goals and strategy discussions. For example, data on healthcare for clients and if they are enrolled in access or not is something we can now collect at CAS. That seems to me an important thing to elevate, but we should discuss and define. I am concerned, but still need to learn more about how the data subcommittee decides what to focus on and how much we help define that. I see data a lot in my role, subcommittee level, work group level. I think we should have expectations around what is shared and how it is shared. Example, communicating improvements in system performance measures over a certain amount of time frame, noted trends, problem areas, and why. I think we can have informed conversations. Other thoughts, things that we are missing in that section about how you all, I'm hearing that we need to continue to have data brought to you all, but really, do you all feel like this is work that you should be doing, or it should be the data subcommittee or the committee?
I'm new, and I think the data subcommittee is important. And I wrote that long one because I'm just not entirely clear on how do they decide what to work on. And there are things that I think should be elevated, but what's the process? How does that work?
I will say, short answer of that is that anything that is coming for approval is coming through the board. But like day-to-day work, doing data deep dives, typically we put that back down into the data subcommittee or on HMIS to then bring back out to you all. As far as kind of these other, like for example, this incorporation of DV data, that is something that we would task HMIS and the data subcommittee to figure out the intricacies behind how do we work through that. As far as big picture of like, what are we doing with data? I would recommend that being more of a board driving the conversation. Think about the board as the policy and the folks on our subcommittees and committee doing the work, getting it done. That kind of is the differential.
So the example I put in there of us being able to collect insurance information during the pandemic, HMIS allowed us to do that. And so we are now collecting, when they come into CAS, we have added information. I don't know if that's a system-wide thing, but I think as a policy matter, if we can get that from the client, they sign a release of information, we can help them a lot more. We can now pull out how many are in Mercy Care, how many are in United Healthcare. It's not perfect yet, but it's giving us information to help tie them to their health plan. So that's why I put that one in as an example. So that is, what do we do with data to me from that one, tying people back to their health plans, connecting them to services. So what do other people think about this? I'm struggling with this.
I do think it would be helpful if the board potentially could establish what data do they want to see on what frequency. I think we're going to start, we're in that process. We're going to start to see that from our dashboard. And as we get a first look at it, so TJ brought at our last meeting, he brought a first look at it, right? at least at this quarter. And then he said, I believe that he would be sending us the link and that we should dive into it. And then at the next meeting, we will be saying, hopefully we work through those questions and if there's any quirks in the data. And then at the next meeting, we would be approving that to be public, if I'm correct. So
Yeah.
I think.
So to give you a little bit of clarity on essentially month one, you won't have a presentation. Month two, you would see just the dashboard as it is, which is inactive. I will be sending that out today after the meeting, along with any strategic planning wrap up. You would have a deep dive into the dashboard, and then month three. So this month at the end of February, you will see the quarterly synthesis, which is what is essentially going to get approved by you all to be a more public facing dashboard. It is the same data that is in the dashboard, but it is happening on a quarterly basis. And there's a lot more to it than just what is in the dashboard live each month. It is also a comparison to county data and other things like that. So that is kind of the frequency of, we didn't want to hit you every single month with seeing the dashboard because that is happening at the data subcommittee and the committee level, but wanted you all to still be able to have that coming on a frequent basis. Does that help give clarity to that?
Yes, so I think this is a perfect starting point for us. We're finally now, this is the first time we're getting this level of information brought to us. So I think this is where we start and say, is this the data we want? What does it tell us? And then how do we use that data to start driving decisions or saying, hey, this is clearly a somewhere we need to deep dive into. Maybe the data subcommittee is involved in that. Maybe it's a program area we need, like, oh, the outcomes are showing this. That's something in our system that we really need to look at. So I think we have the framework now set. We're going to start to be seeing that in the next couple of meetings, like opportunity for deep dive, and then we go from there.
So then, just so I understand, so would a policy decision that might come to the board be something can we say, Solari system, we want this to be a field that is allowable to be collected, the insurance information being one that we had to get permission, and I heard it was a conversation, and that we were able to move that along. Is that the kind of decision the board would be involved in making?
I think that's a policy direction that we could discuss. And then if there's a data element that goes with that, we could certainly make a decision and give direction to Solari, to include that in HMIS if it's a feasible data. So, I mean, I can't speak to what's feasible and all that, but we could certainly go, this is something we want to look into because we're thinking we'd like it to be part of and go down the road. Yes.
Yeah. Okay, good. That helps me a lot. Thank you.
I would also add that, like, if you all are giving that policy direction, it would go back down to data subcommittee about like privacy usages and how do we make this like actually tangibly effective. So you guys can give policy, you all can give policy direction, and then down at the data subcommittee level is like the feasibility, and is this something that like we feel comfortable having in HMIS, and the data privacy, and they may come back and say like we can't do that, but it at least is kind of this back and forth of policy and feasibility.
Yeah, but we can't do anything until we understand the data. So I think we're really in a good position to right now to start seeing that.
Rob, you had your hand up.
Yeah, I was just going to confirm that I agree with that. I really kind of need to see the information first before I could take it to the next step, because I usually have to be able to digest it. So I would agree. And then I also respect the idea once it goes down to the data committee, they need to be able to say if they can or can't, because I know I can wish for a lot of things. That doesn't always have to come to fruition. So just wanted to acknowledge my agreement.
This is Charles. I think, so as a former member of the data subcommittee, I think that they would welcome direction from the board. It's been traditionally a lot of the group trying to figure out what to track and put forth without much policy direction coming down. When we talk about those types of HMIS fields, I think as a board, we're really looking at what are we tracking system-wide, because individual agencies can just add fields to their own data and track those. And and move along. But if we want something that really informs the whole system, that's where we could suggest that. It's not really that difficult or involved to add some of those things to HMIS, but then you have to train everybody and work through those privacy things. But yeah, I think there's a lot of opportunity for them to provide data out to us. We just need to tell them what we want, because it's hard for them to really just develop that whole plan themselves and identify all the things they think we might want.
Well, and to provide an example of exactly what both of you are talking about, one of the major policy decisions that the board gave direction to the data subcommittee on many years ago now, but was what we wanted our UDEs to be. What do those stand for again, staff? I can't remember.
Universal data elements.
Thank you. Universal data elements. Thank you, Charles. And that was a very long discussion because the board's concept was we need this, right? And it might have even come up from the committee and the providers. And then it was, how do we agree on what they should be? How does it impact all of the different providers? How, are we looking at apples to apples? So that was a policy direction, and we could ask for policy direction like that. Let's say it is around your example of medical information. And then the deep dive could occur and they could come back with feedback. But it is essential to have these discussions because, again, it's about measurement. I am hoping that over time, and of course, this has always been the hope, and I think it has been happening over time, but I would like to see more and more collaboration in HMIS because we are serving the same clients. And I know just in the little tiny times that I go in because I want to see something related to one of our clients, one of our programs, say we're staffing something or something comes from a council office and I want to see, have we engaged with this person or whatever. So, I'm going in on a very minor basis to see what's happening in our programs, but I'm always 100% of the time frustrated that I cannot see what other systems these people have touched and how we can make a greater impact with said client 100% of the time.
So as part of our strategic planning, I think we need to define our critical questions. And, how can, I'm not sure exactly what they are, but how do we have the information or transparency needed to make policy decisions? And the UVEs, what should the UVEs are? Every year, to me, I would think we would look at those again. Where are we at? Do any changes need to be made? Yes, no, move on. What are the policy decisions we might, want to direct or that the data committee is looking for? But to me, it's about asking the right questions.
Yes.
Any other thoughts on this before we move to the next few regional action plan steps? All right. So as far as temporary housing, I see this question, it would be emergency shelter or transitional housing. So anything that is versus permanent housing would be rapid rehousing, permanent supportive housing. My apologies for not clarifying that prior to just letting you loose on this.
Just another question. How is that funded under the NOFO? I thought rapid rehousing was under permanent housing, or no?
Yep. So permanent housing would be rapid rehousing and permanent supportive housing, both of those. Okay.
And so say that again, temporary housing is what?
Is emergency shelter or transitional housing. Would like us to coordinate and or help reconcile actual development with gap needs. So seeing the gaps versus the actual development is what I'm hearing in that. Advocating for money for the State Housing Trust Fund. Perhaps there are common implementations, non-congregate, PSH, tiny homes, etc., that can have leadership groups. Do we need to break this into smaller bites? Showcasing the impact of the state low-income housing tax credit and then asking for additional funding. This is something we should have on every committee agenda for updates, discussion, and maybe even presentation from someone who is in fact adding more units and is a COC funded agency, part of the dashboard too that we should track. other thoughts on this? All right. As far as assess and enhance the coordinated entry system, we need to get clarity and community buy-in on the appropriate assessment tool. There should be a regular agenda item. CE providers will be monitored soon. I believe after those visits, a door will be open for ongoing discussion. The assessment and enhancement should be a regular agenda item. If we can discuss and address gaps in more real time, rather than waiting for the next consulting report, that would make a difference for the system and more importantly, clients. The contracted eval will help, but it is important to have a way to hear everyone's voice in this. I feel like many voices are stifled around this important piece of our service delivery system. Additional thoughts or feedback on the assessment and moving forward on that?
Just a question to staff. Do we have to find outcomes for the assessment? Do we know kind of what we might get back, or is it kind of just?
We do. It is a pretty, there's a defined scope of work as to what we are looking for. I can send it out in our packet later today to all of you. I will say we have a defined scope of work of what we are looking for, but the contractor is responding back to that scope of work. So we can't necessarily, we can say what we want, but not necessarily that is 100% what we will get, because that is based in the final contract, which hasn't been signed yet.
Okay.
And I will also say that the money for the coordinated entry evaluation is not just for an evaluation, but also improvements. So it is a set of money that is to evaluate and also implement. So it won't be just in the next 6 months we see an evaluation, because there will be that scope that is the ability to make changes also.
I would appreciate to be able to see the scope. That'd be great. Thank you.
Awesome. I will send that out.
So this is an area in coordinated entry. And I want to, Tish from UMOM, we had a wonderful conversation the other day, and we thought that we could not get trained to help onboard people in the family housing hub, but learned differently that we can do that out at Glendale. And I don't know all the details. I know we're working that out, but that's kind of a big deal to me, because we had a different understanding. So what is the role of this board in continual improvement on access to coordinated entry? Because it's great to do evaluations, but I feel like it's too important if there's an issue that comes up and is to be discussed. When I started here, and a lot of it's, sometimes it's misinformation, but I heard we need to have more hours and to get people into the family housing hub, and how do you streamline that? And probably same with the adult system. And I know more regional coordinated entry sites, which we are in Glendale now, CASs, have popped up. So I feel like there should be a place for real-time discussion of things that need to be elevated, if they do, to the board on coordinated entry. And
I'll leap out there, Lisa, for you and just say, from my perspective, which is only my perspective, of being both a provider here in Chandler and then, hoping to be able to add some wisdom at the regional level, and having been around when there wasn't a system and through the creation of the system. So this is just my perspective and my experience. This has been a huge challenge for the board. Where does the board fit in? What level of oversight should the board have? What's the level of autonomy of the coordinated entry providers themselves? How do providers weigh in? How does it affect different populations and geographic areas differently? It has been a challenge, because it's a critical part of our system. and everybody has different needs and wants and frustrations and goals. And so this is where I'm hoping, personally, I'm hoping some more transparency and light is able to come in, and that we all can not take this personally, right? And just like sometimes I feel like the hubs themselves feel attacked, and I get that, like it's their baby, they've worked so hard on this, and then someone's saying, oh, this isn't working for me, or I need more, or they're getting too much, or so I get it from their perspective. I get it from the provider perspective. It's like, wait, this isn't serving me well. I get it from the jurisdictional perspective, like, wait, you want me to put our funded units into your system that any jurisdiction could have access to? I mean, there's so many different pieces here. Yeah. And I'm hoping that we can all build more trusting relationships and be, committed to the system, and be able to recognize individual provider and jurisdictional needs, and somehow just shed put the floodlight on this, and what can we do to make it work for everybody, recognizing that it's challenging, and that the hubs are doing the very best they can. But I think there does need to be a leader group on this, and it has not been the governing board. It has been whoever has had more voice at that moment, whether it was the hub itself, providers themselves, jurisdictions themselves, whoever was able to harness the power to get what they wanted to get done. This is my perspective at that moment, because there's just been a lack of leadership, or a lack of approved leadership. Like there hasn't been this is the group that's going to make the decision. And there is a coordinated entry oversight committee, or maybe we're calling it something else now. Maybe it's a subcommittee of the board, right?
Yeah, and I do know they have the same conversations at the subcommittee level.
Right.
Looking at being more transparent, looking at onboarding and training, setting up MOUs for smaller providers. So it is happening, but it's happening slowly. And even looking at a communication marketing plan, because as Lisa said, there are a lot of, I didn't know you could do that. And why didn't I know you could do that? So we're trying to work through that. And I think our conversation yesterday was great, Lisa, because we're going to work with you. I'm putting together a scope of service and training and onboarding and continuing to monitor and support your staff team so you can do the same work that we do here in Phoenix out in Glendale.
It's awesome. Thank you. Yeah. So maybe that, that group tells us what are their 3 goals for the year. I think if it's just too nebulous, and then when they come to us with the report, what are your goals this year?
And I know they also want some direction and guidance. So if they get that from us, they're ready to run with it.
Yeah. And that's where I see we've been lacking is, this was a hard system to get up, and lots of lives have been over time. Some of those people are at other organizations now, but I mean, people have put in immense work on our systems, and I just want to get to a point where we can all say, yes, I know, I recognize that, and I see you, and I appreciate you, but here's where we need to move towards. Let's all do this together. And I think that direction needs to come from the board with immense interconnection with the oversight committee.
It's good. So this is why it's good to have a strategic plan from the board, because then we can say, here's realistic goals, and here's what we want to see. And maybe it's just knowing what we're going to be measuring.
Danielle, you had your hand raised.
Yeah, so I just have a question. Being new, hearing all the different perspectives that go into the coordinated entry assessment, is there a survey or an assessment from the people who are actually using coordinated entry, which would be the clients? Are they surveyed, or is there any assessment done with them? Are their voices included in any changes or enhancements that are done?
Generally, there is both surveys and focus groups and one-on-one interviews. we can't say at this point like exactly how that will go through because a contractor hasn't been chosen at this time to complete that evaluation. But in their like response and in the contract, that would be kind of laid out as to how they anticipate to carry out that work. But typically it is a combination of focus groups, interviews, and online surveying. All right, I'm gonna move us on to this last one. Really looking at increasing access. We need to get big players involved, shining the light on the stagnant coordinated homeless line item in DES budget, inviting David Bridge and Stephanie Smith from Access on a Medicaid crosswalk tour. It would be nice if this too could be coordinated to minimize queues and impact on surrounding community. I think we need to do more strategic discussion on this. It is critically important, so we know what we are wanting to promote and measure. Any additional thoughts on that?
I would like to understand better the minimized queues and impact on surrounding community. I'm not sure if I know what that means.
Yeah, that was me. We just had, just this week, reports of service providers and complaints from residents and business owners of queues when there's certain services. And I think that's always been the thing when you're trying to provide services to people. How do you, I mean, everybody's entitled to the service. The businesses are entitled to provide the service, but there's that nexus, right? I mean, we talked about it earlier, even the idea of putting a neighborhood. I mean, if you put a neighborhood leader on there, you might want businesses too, because you want to understand their perspective of how they're impacted. And it tends to be the service. I mean, a lot of people look at it as the shelter, and it's not always the shelter. It's the surrounding services that people are queuing up for or waiting for. They're not homeless because they get this service here, their food, their showers here, and they live out on the street, and you're trying to convince them to get it all on the inside instead of everywhere else. So when you have separated service delivery models and then we're enticing people to become independent and get on their way, you get mixed up in this, the NIMBYism of everything. And that's all it is I think service delivery is super key, and its impact on the community is super key to in that regard. That's what I mean. And I don't know if I have it right or not, but that's what I was reading into it.
No, that's good clarification. So an example might be a queue for a Suboxone clinic every Tuesday at 10 a.m. Or, okay, I get it. Thank you.
So it's, oh, go ahead.
I'm sorry, I just have a question as a new person to the system. How long does it usually take a homeless participant, to get an appointment in the behavioral health system? And
so many variables depending on, their level of functioning or capacity at the moment. Their level of, do they have navigation services to assist them? I don't know if that maybe there is an average length of time. That would be great to know.
Yeah, I would love to know that.
I think I wanted to jump in because we just went through a use permit process to purchase the Phoenix Inn for seniors. And in our requirements, stipulations, we can't allow people to line up or queue up. And so to me, what are the best practice models that we need to be promoting in this arena? How do we serve people and manage the impact on businesses and neighborhoods so that they allow us to be there? What's the business case we can make? And because when we went in for the zoning on that, we knew we couldn't talk about mental health, that there are going to be people with serious challenges, because that would shut us down. And it's the elderly population that we're going to be serving, prioritizing 60 and older, but we can have 55 and older. So what's our role in this? How do we help elevate and serve people in communities where we know we're going to have an impact on businesses and neighborhoods? What are the best practice models, maybe, is the bottom line question, because our new shelter is a closed campus. That is the only thing that we knew the neighbors would agree to. So we can't have anybody queuing up, no lines, nope, only people staying there. So this is a tricky one that you're raising. And same thing happened when we opened our center in Glendale, and we don't have any lining up, queuing up. And that was with a lot of neighborhood discussion in advance. How are we going to manage that? And we're serving a lot of people, but it's through a dispersed partnership model. So I'm the one who wrote, I think we need to talk about this more. What's our strategy in this and what are our measurables? Because I don't really know what they should be.
Eric, you raised your hand.
Yeah, when we were talking before, Lisa, a year ago about, the opportunity in Peoria, that was the same thing we were dealing with. It had to be a closed campus. It had to be a destination, coordinated entry, and then services were provided only to those residing there. I think that's key in the 1270 and the 770 numbers. I think all of us dealing with that, trying to locate it anywhere in the valley, we're going to have to contend with that. But having just standalone service providers out there that are going to have a service to the open homeless community is what kind of drives the negative impacts on the community. And again, they're entitled to do that as a business. The patron is entitled to queue up and get in there. It's just, that's the nexus. We tend to fight that visual every time we're trying to sell a really solid closed campus, internal service delivery driven model. And people just can't identify and separate the two. And it gets down to, like so many things we deal with in the municipality, is private property rights, business rights, civil rights. All of those rights have to coexist. And that's what you get when they coexist, is a negative impact on somebody's rights here or there, or their perceived rights.
Mm-hmm.
Eric, I wanted to go to you. Yeah.
Yeah. So I love this conversation. I'm gonna address a little piece of it, but it was brought up, and I believe is in the regional action plan. And that's encouraging or training or working with localities on interdepartmental committees or commission, groups. And the reason I bring that up here is, like, y'all are, all of this is right. And to fight, NIMBYism and, folks that don't have the right information, disinformation. The whole spectrum, this is what I do for a living, the whole spectrum of community engagement at the local local government level is under huge stress right now, as we all know. I think a start of that is, and this is something, again, we can lean into, I hope, is this idea of intergovernmental communication, so that, on the front end, in the local government space, you've got, the law enforcement, first responders, as well as, staff that work in social services, et cetera, aligned and aware of what's happening across the local government first. And then I think that can blend into the community engagement efforts, initiatives that I know y'all are. I know several of you are, this is what you do for a living all the time. But being able to bring those people together into some level of a forum, and then translating that into a community message around, just what is happening, just what are these services, just what do they afford people. I may be an eternal optimist, but I think those are some of the steps that can happen, and think it would be a cool, I think it's aligned with MAG's roles too. So anyway, that's just my 2 cents.
Thanks, Eric, and thanks, Tish, for those comments. I added those up to the top of our mural board. So we have about 4 minutes left. I don't want to keep you over. Wanted to just kind of the last part of this mural that we will, I will send this out to you so that you all have access to it and can edit it over the next 2 to 3 weeks before we meet again. But really, is there anything else that we didn't capture that you all wanted to include in your strategic plan? And so really, these blue sticky notes that are on your mural board are for that, is to what else do you want to accomplish in the next year? MAG staff between now and 3 weeks from now, when we meet again on the 25th, we'll be kind of taking all of this information, bringing it down, synthesizing it, and having it as kind of, these are the steps that you want to accomplish, and saying, yes, no, we do want to do that. We don't want to do that. This is how we're going to do it. And this is something that we want to task down to the committee or the data subcommittee or coordinated entry, or this is something the board needs to be doing and we need to see it on a monthly basis or a quarterly basis during our board meetings. So that's kind of our next steps, the combination of this mural board and your communication strategy from last week, kind of going into our last session. So I will send this out to you all. If you have additional thoughts, feel free to add it to the mural board or send me an email. And then we will move into our session on the 25th. If that is not enough time, we will kind of regroup at the end of our session on the 25th and talk about next steps and where we go from there. Any other things that you all need from us as staff, or prior to us, the next strategic session or the next board meeting on the 28th?
Thank you, Katie.
Of course. Awesome. Well, I will let you go with 3 minutes to spare. And I didn't give you as much time back as last time, but we will get this all out into an email before the end of the day.
Awesome. Bye, everybody.
Thank you.
Take care, everybody. Have a good weekend.
Bye, everyone. Thanks.
Thank
Thanks, Katie.
you.